Hello and welcome. It's my pleasure to introduce Dr. Neda Ebrahimi. Neda has a master's and a PhD in pharmaceutical sciences from the University of Toronto. She has spent over 10 years investigating outcomes in pregnancy and neonatal outcomes following different gestational exposures. Prior to joining CCNM, Neda was a research coordinator for the largest national longitudinal study investigating clinical outcomes in children with demyelination at SickKids Hospital. Neda currently works at CCNM's first microbiome research resident. So thank you, Neda, for joining me today.
Thank you. Thank you for having me.
Now, I'd like to start off by asking, when did you first become involved in research and what drew you to make a career out of it?
Yeah, sure. Well, I've always been interested in problem solving and answering questions. And even as a kid, I used to fantasize about being a scientist one day. It was in my undergrad years that my interest in health and medicine peaked. I completed my bachelor's in medical sciences and pharmacology and toxicology. And in my final year there at Western University, I met my master's supervisor, who was one of my instructors at the time. He was director of the Mother Risk program at SickKids Hospital at the time. So the following year, I joined him at the Mother Risk department at the Division of Clinical Pharmacology and Toxicology at SickKids, and this was my first segue into research in maternal health or maternal medicine. And during the next 10 years, I studied disease management in pregnant women with different medical conditions. And I also worked part-time as a counselor, giving advice to pregnant women and healthcare providers about the safety of different exposures in pregnancy and lactation.
Wow. So it sounds like that passion started off as a child, and it's so inspiring to hear your journey and how it just kept going. So can you share more about your background and experiences then before you joined CCNM?
Sure. So in the 10 years I was at SickKids, it was an opportunity for me to complete both my master's and PhD there. I stayed at the Mother Risk program. For my master's, I conducted a number of studies investigating or looking at common medical conditions in pregnancy and the best way to manage them. One of my bigger projects looked at the safety of prescription anti-hemorrhoid medication in late pregnancy. Just shortly after I defended my thesis, my supervisor hired me to oversee the development of a pregnancy registry for women with multiple sclerosis. And one of my early discoveries in this role was that many of these women in our registry were taking exceedingly high doses of vitamin D as per advice of their naturopaths. And usually speaking, pregnant women especially, are quite conservative about taking supplements or medications without strong evidence. And the amounts that some of these women were taking far exceeded what's recommended by Health Canada and the Institute of Medicine and World Health Organization. So right then and there, I decided that I would like to focus my PhD on looking on MS relapse in this group specifically. And so I was tied up with that for the next few years. And while I was wrapping up my thesis on this study, one of my PhD advisors, who was a senior scientist and a pediatric neurologist at SickKids, asked me to join her team and to overlook the final stages of a national study that investigated pediatric demyelination. So as you mentioned in your intro, these were long-term outcomes in children who were diagnosed with MS. It's one of the first studies to look at these clinical outcomes, and it was a longitudinal study in its 10th year when I joined. So it granted me the opportunity to not just work with children and parents, but to understand the amount of coordination, resources, and commitment needed to conduct national level clinical research, and all the challenges that were involved. And we specifically focused on every aspect of health, so mental, nutritional, physical activity, MRI images, blood, genetic markers, cognitive. It was the full dream clinical package that any researcher would want to conduct if they're looking at clinical outcomes. I stayed in this role for about 18 months after I defended my PhD. And then when I applied to the opportunity at CCNM, I finally felt ready to take my training with me and to conduct my own research. So interestingly, this new shift in career coincided with my first pregnancy, and 9 months into my new role, I also welcome my daughter, Neela, who's 21 months now.
Wow. Well, congratulations on the new role, on the new baby.
Thank you.
I'm sure you have so much knowledge behind you. So hopefully you had that to support the pregnancy.
Yeah, that's one way to look at it for sure.
So what research projects are you currently working on?
So my training mostly, I wanted to involve my training with pregnancy and exposures. And so the focus right now is on maternal mental health, which is an underlooked component or under researched area in medicine. We know that maternal anxiety and depression have both long-term and lasting effects on both the mother and the infant, and the adversaries do carry on into adulthood for many of these children. And in the context of microbiome, there's now concrete evidence that the health of our gut dictates mental health. So essentially the types of bacteria that we carry in our gut and the type of metabolites they produce dictate the incidence and even the severity of depression, anxiety, and many psychiatric disorders. It's a new field. It's still up and coming. There's a lot of interest in it, and I'm specifically interested in pregnant women who are at a higher risk for having anxiety and depression in their pregnancies or in the postpartum period. And currently, I'm I have put together a proposal to investigate the effect of high fiber diet and supplementation with fish oils and probiotics on mental health outcomes in these women.
Wow. Well, I mean, mental health is such an important topic, both in the context of the pandemic and just in general. So being able to look into the perinatal research is very interesting. Now, why do you think it's important for naturopathic doctors to be creating research?
I absolutely think that ongoing research is a must for any healthcare provider. Our understanding of human anatomy and physiology is constantly evolving, and with it, challenging our approaches to disease management, and in many cases, advancing it. And I really believe that a growth mindset is founded on ongoing education, acceptance that change is inevitable, and the ability to adapt to these changes. Something that works can always work better, and something that doesn't is a teaching moment for all of us. And research does just that. It learns from failures and it advances the success. And it's absolutely essential that any healthcare provider has one foot in research, because that's where the knowledge comes. That's where knowledge is generated.
Yeah, wow. And I'm sure that you can attest with the long path that you've taken that is not a straight road. There's definitely hurdles along the way, but like you said, it's something.
It's not an easy path, no, but no pain, no gain, right?
So if a CCNM student is interested in microbiome research and would like to get involved, how can they reach out or learn more about opportunities that arise?
Sure. So I definitely value the time and dedication from committed students. I also welcome the opportunity to become a better mentor myself and to engage with interested students who are interested in research. So if the interest and most importantly, the commitment is there, just email me, reach out. Let's get to know each other. You can reach out to any of the other staff in our department. Everyone's doing a lot of exciting work, but yeah, the first step is to email one of us.
For sure. Perfect. And I will definitely put down your information in the
Mhm.
description box after the interview. So I'd like to conclude this interview with a lightning round of questions just to get to know you better. So what is one book or other resource, it can be a podcast, that has left a mark on you?
Right. By lightning, you mean one word answers, or can I just elaborate a little bit?
No, elaborate a little. I'm sure people
Okay.
would like to know.
Okay. So regrettably, I spend a lot of time on screen reading academic based articles and papers and whatnot. It leaves very little time for non-academic material, which is something that I try to change every year. Right now, I'm working through a book called The Road Less Traveled by Dr. Morgan Scott Peck. Normally it would take me 2-3 days to get through the book, but now I read 10-15 pages every night before putting my daughter to sleep. So it's going to take a while, but I do listen to a lot of podcasts and TED Talks. Focus mostly has been on neurosciences, psychology of parenting, and things like that. But most recently, a TED Talk by Josh Kaufman really piques my interest. So the topic was that 20 hours of condensed effort in anything is enough to help you master a skill. So that could be learning an instrument, like a musical instrument, an art, a new skill, anything.
Mhm.
And I'm really interested in testing this theory out. I'm been trying to apply it to my Spanish, but 20 hours sounds longer than it looks. So yeah, I'll let you know how that goes.
Yeah, I'm interested to find out. I think 20 hours seems doable, but
For sure doable, but yeah, it's yeah. I invite you all to test it out, and yeah, it will be fun to see how much progress people make.
okay. Now, what is one non-negotiable thing that you do every day?
For sure, I'd have to say working out. For the last 10 years at least, I do exercise at least 4 or 5 times a week every day. Throughout my pregnancy, I did. I think the only time I took a small break was a 3-week break after my daughter was born, because I was recovering from a episiotomy after my delivery. I'm a big advocate. I really think it's essential for even 15-20 minutes a day is a must for anyone. It's as important as eating and sleeping and breathing. And it's an important part of health. So, big advocate.
Yeah. And can you name one thing on your bucket list other than learning Spanish?
It would, I'd have to say, would be learning the piano. So that's another place to apply the 20 hours and see if it works or not. I don't think I'll be an expert, but yeah, I think you could at least learn, intermediate skills.
Yeah, maybe how to play Happy Birthday. That'll be the first.
At least, right? Yeah, or keep up with the nursery rhymes that my daughter's learning now.
Okay, and lastly, can you give CCNM students one piece of advice for their future endeavors?
Yeah, I really do believe this. I think learning never stops, especially for healthcare providers. And these have this unique opportunity to learn very intimate details from their patients at a level that most healthcare providers don't. They spend a lot of time with them and treat every patient as a learning opportunity, understand why interventions work or don't. Take that knowledge, share it, let it be critiqued, challenged, reproduced. Trust that science and research can make you a better clinician. That would be my advice.
I think that's really good advice. I think a lot of times we like to think that after graduation we're done, but we'd be doing an injustice if to our patients and ourselves if we didn't continue on with learning.
Absolutely. Yeah.
Well, thank you so much for taking the time to join us today. I enjoyed getting to know more about you both personally and professionally. And for any students that do want to reach out to work with Neda or to get to know her a little bit better, you can either reach out to me or to Neda personally. We will be attaching all of her information to this interview.
Yeah, my pleasure. Thank you.
Thank you.